Hi viewers, welcome back. Today's class we are going to talk about truncus arteriosus. So as a part or continuation of the cyanotic heart disease, this is the second condition which is causing cyanotic heart disease. Okay. So as said, in cyanotic heart disease the baby is going to be blue in color. So now what we'll see what is happening here. Okay. So, aorta and the pulmonary artery starts as a single vessel. So, you know the right ventricle has to lead up with the pulmonary artery and it has to go to lungs for purification, and the left ventricle has to lead up with the aorta and it has to go for systemic circulation. But here what is happening? Both these vessels are a single vessel. They are joined, they are formed as a single vessel, and then they are dividing it into two. That is like it, first it will be a single vessel, then it is dividing one side as aorta and other side as a pulmonary artery. So what will happen? So mixing of blood will take place, which will cause cyanosis for the baby. Okay, so you have to remember here it is like a single vessel which is then getting divided into two vessels, which is causing cyanosis in the baby. Okay, so here aorta and the pulmonary artery start as a single vessel and becomes two vessels. Okay, so cyanosis, the signs and symptoms will be cyanosis because of mixing of blood, and there will be breathing difficulty in the baby. So as we said earlier, there will be cyanosis, and to compensate that there will be a severe breathing difficulty, there will be tachypnea for the baby, and there will be severe respiratory distress, and the baby will have in tachycardia also. Okay, and usually the baby will present with cold and clammy skin, baby will be restless, and the baby will not put on weight, or failure to thrive will be present. Baby will not show any growth improvement. Okay, so these are the signs and symptoms. And then management, coming to medical management, we have digoxin. So digoxin first is to improve the efficiency or the working condition of the heart. So we are giving digoxin. And then we have diuretics. As we said, there is a mixing up of blood. What is happening? There will be increased pulmonary circulation. So because of that, there will be pulmonary edema. To cut down that, we are giving diuretics. And then we have ACE inhibitors, that is like to dilate the blood vessels. So when you dilate the blood vessels, at least more perfusion will take place and the baby will not have cyanosis. This is the logic of giving ACE inhibitors you are giving. So finally, you have to improve the nutrition, and the supplementation can be given through EBM, and with the NG feedings you can provide. Okay, so this is with your medical management. When we are coming to the surgical management, what we are going to do, you remember the surgery in the transposition of great arteries. Similarly, here also you have to do the same type of surgery, where what you will do, that single artery, no, that you have to divide that into two, and then one will be connected directly to the right ventricle, which is going to the pulmonary artery. That will become pulmonary artery and it goes to the lungs for purification. And then aorta, which is getting connected to the left ventricle and which is taking pure oxygenated blood, and it is going to the systemic circulation for supplying the whole body. Okay, so this correction has to be done. So this is with your transposition of great arteries. Hope you understand the class. So it is a very simple topic, where it is like only you have to remember only one vessel is present which is getting divided into two vessels. So mixing up of blood is taking place and the baby is going for cyanosis. So medical management you have to do, and then anyway, this it will not be useful, just it is a supportive treatment for medical management you can give. And then you have to go in for surgical management, where you have to completely rectify the problem, that is with your surgical repair you have to do. Okay, so this is with your truncus arteriosus. Hope you understood the class. In case if you have any doubts, kindly give your comments in the comment box. Hope you understood, and until we meet in the next class, take care. Bye.